Welcome to the course. I think you will find the course very interesting as well as very adaptable to your occupational lives. My name is Dr. David Milan, and I will be your professor for this semester. Throughout the course of the semester, we'll be looking at various agencies as well as different types of case studies concerning disasters, rioting, and the advent of Ebola. This course will only allow you to have an academic approach, but also allow you to have an academic approach to crisis management, as well as utilize your skills in critical thinking regards to the incident command system. We will also be looking at general staffing during such crisis events and also taking a look at other areas within the incident management system. We'll take a look at natural and biological hazards that are impacting North America. But first, I'd like to mention some of the incidents that took place in 2005 with Hurricane Katrina. Hurricane Katrina struck in August of 2005 in Louisiana. The damage and devastation that took place with this catastrophic event probably could not be imagined. Even with the advancement of technology, the use of radar, early warning systems, it probably was unthinkable regarding the types of destruction and life loss that would occur with this catastrophic event. As the events unfolded, we could see the need for the logistics, additional planning, alternative care sites, and a lack of medical facilities that were available due to the flooding and the advent of the communication failure due to so many antennas and towers being rendered useless. One of the key components to remember in any disaster is understanding communications may fail during the event. As a best practice to ensure that communications don't fail, training in normal and stabilized conditions is necessary. Training and education are at the forefront of being able to mitigate circumstances that may arise during an emergency, disaster, or catastrophe such as Hurricane Katrina. During a catastrophic event such as Katrina, a multi-tier response is needed in order to address the issues of life safety, media-related issues, as well as being transparent as possible with the community stakeholders and those residing in the disaster-stricken areas. In the case of Katrina, Incident Command and the General Staff were confronted with several issues. Some of the main concerns with the command structure was how to handle the lack of personnel and the availability of personnel to handle all the situations that were occurring at one time. It has been said that approximately 33% of all personnel that are working within an agency, public entity, or other organization will leave their posts in order to tend to their families, loved ones, or their pets. Let's turn to the actual event in accordance with the Emergency Assistance and Disaster Act within the Louisiana office at the time. The governor was able to establish provisions that were needed for such an event when the hurricane was approaching. Unfortunately, the majority of the evacuation routes were jammed with vehicles, other responding agencies, as well as trucks that were competing for space on the highways. Unfortunately, due to the amount of traffic, many of the autos were abandoned and just added more issues to the highway system. Looking further at the disaster assistance plan, in the event that all the resources were used up immediately, there were mutual aid agreements and contracts that were established by Congress back in 1996. This was in the form of the temporary shelters, cargo aircraft, helicopters, and National Guard troops, if necessary. Despite the fact there seemed to be enough in the actual plan in place, both the state and federal levels, there seemed to be a framework that may have been lacking due to the magnitude of a storm. It was difficult to maintain transportation and communication, public works, and engineering aspects during this time. Although there were adequate warning signs in regards to the type of storm Katrina was going to become, there was still a lack of preparedness both on the civilian side as well as the government side in overall response. Several of the warning signs were not acknowledged by leadership, and in some instances, perhaps avoided the evacuation warnings of several areas that were directly impacted by the storm prior to the storm's arrival. The branches of the military service didn't prepare for helping out and were not ready to supply the areas located near the Superdome, as well as other state shelters. They would also be assisting in law enforcement and traffic control where they were needed in some instances, providing medical personnel as well. Once the mandatory evacuation order was given, there was still the issue of those who refused to leave and did not believe the storm would impact them. Oftentimes, in some of these areas, they were forgotten, and during the course of the emergency in dealing with these special needs populations, there were some issues that arose. Some special needs populations we need to consider are the elderly, pediatrics, as well as those who have language barriers. They also need to be included in this type of disaster plan for evacuation. Once the storm came ashore, as it is the case in many issues, they're facing and dealing with the breaching of the levees. With the storm's sustained winds at 190 miles an hour, there was very little hope that the winds would not diminish the capacity of the levees. Many of the hospitals that were able to provide services were rendered useless within hours due to the fact that some of the storm's magnitude and the flooding that was occurring so rapidly created these breaches. Although the storm weakened, as it usually does once it does reach landfall, there were still tens of thousands who were not evacuated from the flooded areas. One of the areas to keep in mind that normally fails was dealing with the communication system. Once the storm had damaged the communication system, several towers and other towers, they were rendered useless and the communication systems had failed. Since the communication systems had fallen, there was still a greater chance that more casualties, more issues, as well as the levees failing would all occur. For all the parts of this scenario, this was occurring right before our eyes. Although many rescues of tens of thousands of people were still in process and the locations therein were advantageous for these rescues, still over 80% of Louisiana was flooded and there was very little room to move medical supplies as well as food and water. Thus the crisis became out of control and there were many areas where personnel had left their posts in order to attend to their families. It also caused lawlessness within the city, created further medical emergencies, continual arising with the growing anger amongst the thousands of people who were not being helped, and then the federal responsiveness that appeared to be lacking was creating such havoc. In order to stop the falling of the dominoes, something had to be done at this time. Unfortunately, the lack of communications and part of the reports that were going down within New Orleans became skewed. Eventually, the Department of Defense was called in to step up and perform some of the logistics. Although the stepped-up response did appear to assist, it still took several days for the National Guard troops, supplies, and other personnel to arrive in an organized manner in order to assist those in need. Unfortunately, due to the magnitude of the storm, the death toll was shocking, as well as some of the incidents that were taking place. Search and rescue operations were underway once personnel were able to arrive, but there was also the challenge of rebuilding and reconstructing New Orleans after such an event. In turning to SARS, this may also be compared to Hurricane Katrina, but in a different capacity, as this is a public health event. Some of the questions we do have to ask are some of the most difficult during times of public health strife. What are some of the things that are different with a public health event as opposed to Katrina? What are the significant issues that arose for public health officials that required a different type of response other than dealing with a routine emergency? The emergence of SARS came into Toronto via a commercial flight from Hong Kong, and at this time, this type of virus appeared to be mysterious and unknown. Eventually, the virus would spread to hospital workers who had treated the infected patients before, and due to the fact that it was unforeseen and this was the first type A virus that was found in Toronto. Some of the issues that were confronting the hospital at this time were dealing with where to put these patients, their location to patients in the emergency room, as well as trying to figure out what type of virus this was. At first glance, it appeared that it might be pneumonia, but there were some thoughts also that it might have been related to tuberculosis as well. Eventually, the World Health Organization pronounced a global alert in regards to the outbreak of typical pneumonia commonly found in Hong Kong and Vietnam. After a few days of tests, research, and examinations, it was determined the World Health Organization that this was SARS. The World Health Organization then indicated that this would be a global alert based on the seriousness of the illness. Some of the main issues now confronting the hospital were dealing with the number of patients that came in contact with those who were infected with SARS, the hospital workers that also came in contact with those patients, and how to maintain isolation and quarantine for those people who had already left the hospital. There was a dire need at this point to make someone in charge of the incident overall. Specialists and other groups that worked countless hours behind the scenes in order to put together a strong document regarding proper procedures and precautionary measures was needed. Infection control measures were also established for both hospital personnel and visitors that were entering into the hospital setting. Eventually, every hospital was able to create a SARS unit. Personnel were then given special masks, gloves, gowns, protective eyewear, and face shields in order to minimize the exposure to SARS. Unfortunately, some of the measures that were taken were not true to form due to the lack of data and research that was being conducted in such a short period of time. Thus, there were many directives that appeared overly long and they were complicated and did not address or appear to be needed in such an emergency. Though the use of isolation measures were definitely adaptable for quarantine, proper hygiene as well as performing screening at Toronto's International Airport appeared to be minimizing some of the SARS issues greatly. There was a combination of political pressure, the fear of the unknown, public outcry in demanding information regarding SARS, as well as working alongside the World Health Organization in maintaining standards. It was apparent that after the first outbreak, the public wanted to know more information. But the lack of information was evident due to the fact that this was already a relatively new virus, and research was being done quickly as possible. Again, much like with Katrina, this event showed there was a lack of communication, lack of resources, as well as a lack of coordination up front in order to address this issue.